We started this event today with the words health is wealth. We also heard Ms. Sania Mirza mention health is an investment, not an expense. We've definitely heard prevention is better than cure. These are timeless words of wisdom, not new to any of us. We actually actively pass it along to the next generation in our families, in our schools. Yet, here we are, country of 1.4 billion with 101 million diabetics, 136 million pre-diabetics, and about 1.5 million new cancer cases every single year. For the last 30 years, many of us have actually witnessed the amazing economic revolution in the country. With the boon that liberalization brought us, the modern living, conveniences, infrastructure, along with that came the bane of non-communicable diseases. We're talking about diabetes, hypertension, cancers, mental health. A number of these have also entered our lives. Just yesterday, we released the 4th edition of the Health of the Nation. This is Apollo's perspective on how healthy we are as a nation. It's based on our data set across all our group entities who screen people from our cities to rural areas. The findings are quite grim. We actually found that the median age of cancers in our Indian populations are a full decade younger than Western populations. Breast cancer, median age was 53. In Western countries, it's about 64. Similar finding for lung cancers. We found that 1 in 3 people came in as a pre-diabetic. Pre-diabetic. 2 out of 3 people came in as a pre-hypertensive. This is great because we were actually able to catch them before they became a disease and allows us to actually help them manage and live happy, healthy lives. We also find that sleep, stress, depression, anxiety, all of these have come together, are pervasive, and are impacting these chronic conditions. What do we do about all this? Now's the time for us to be proactive. We need every one of you to be pro-health, and we need every one of you to actually nudge one another in your communities, in your families, to be pro-health. Being pro-health actually means very different things to different people. For some, it is actually being in favor of preventing the illness from coming. For others, it is actually proactively taking steps for the complete holistic mental, social, and physical well-being. What is it for you? At Apollo, for us, being pro-health actually means improving the health span. What does that mean? Life expectancy today is about 70 years. We all know people, family members, who are living well beyond 70 as well. So longevity is no longer a concern. Many of us are going to live long. The question becomes, how many years are we going to live healthy? And that's what we call health span. And so at Apollo, our goal and our objective is to ensure that we are helping people spend as many years possible healthy. And about 40 years ago, 4 decades ago, our chairman, Dr. Pratap Reddy, came up with the Master Health Check. Today, that's a verb. We ask, "Aapne Master Health Check kiya? Is saal aapne Master Health Check kiya?" Right? We ask each other aise. And it's actually really taken over in many parts of the country. But we realize that after all of the years of science, medicine, and technology, we can do better. And with that, we've actually designed Apollo Pro Health, which brings together personalized risk identification. I'm different, You are different, she's different. Every one of our bodies are different. And therefore, what are you at risk for versus other people? Second, we can predict risk. Our data sets have allowed us to create AI engines that are specific for the Indian populations. And based on that, we can say, how likely are you to have a heart event within 10 years? And hopefully, when we make that real for you, you'll take steps to change that trajectory for yourself. And the third thing is our experts, doctors, and our health coaches guide you on a path to wellness. It's not enough to tell you, ye problem hai, ye problem nahi hai. It's important to also tell you what to do next. And that's what we try and do with Apollo Pro Health, which will be offered at Apollo One. And I'm absolutely delighted if you actually see the ambience and the service. So kabhi we walk into our hospitals and clinics for the health checks, and by the time you navigate through the crowds and get to the health check area, the BP goes up, right? And that's what you end up measuring. But the idea, as we designed Apollo One, is to ensure that we are able to give a service and a space that truly should complement preventive care. And very excited to bring Apollo One to Delhi and encourage every one of you with the might of your pen to spread the